Good morning. Excuse me. Good morning. Good morning, Chairman Hurd and Ranking Member Ledger Fernandez. My name is Victoria Kitcheyan, and I serve as the Tribal Council member at the Winnebago Tribe of Nebraska, and it's an honor to testify today. The Winnebago Tribe's experience both shows the consequences of failing health system and the transformative power of tribal self-determination. When tribes take control of their healthcare systems through 638 contracting and compacting, we restore trust, we save lives, and we build the kind of care our people deserve. When I testified before Congress in 2016, the IHS hospitals serving our community have been operating with life-threatening deficiencies for nearly a decade. CMS found immediate jeopardy violations, nurses weren't trained in to administer emergency medications, and patients were sent home only to be life-flighted later. Families who lost loved ones, even to preventable deaths, were prevented from receiving those medical records. And in 2015, the hospital lost its CMS certification and our community's trust. After years of urging IHS to fix these deficiencies, the Tribal Council made the difficult decision to assume control of a troubled hospital. And through a self-governance compact, we were able to restore that certification. In July 2018, we formally took over what had become a deeply troubled hospital. We renamed it 12 Clans Unity Hospital and built the Winnebago Comprehensive Healthcare System. And we brought together tribal health programs under one unified, culturally grounded organization. We established a governing body, a board of directors, a leadership team, and new policies. Everything was on the table. We began the long process of regaining CMS certification, and within 18 months, with expert documented major improvements, we regained CMS certification in April 2023. Since taking over, we have dramatically improved care for roughly 10,000 tribal members and patients. Some of the examples include 2020 net revenue for patient services were $6 million. We have grown that to nearly $30 million. In 2026, we project, for the first time, we're budgeting for third-party revenue to exceed the compact. Medicaid makes up for 50% of those revenue collections, while private insurance makes up for 40 to 45% of those collections. Also, by 2024, nearly all our medical staff were permanent employees rather than short-term contract employees. We created a 24/7 sexual assault nurse examiner program. In 2025, our emergency room received Nebraska's Level 4 trauma designation. Our quality measures continue to rise. Hypertension control is up from 53 to 70%. Our emergency room nurse satisfaction reached the 94th percentile nationally. And we launched a modern electronic medical health record system. We brought specialty services home, including OBGYN, dermatology, orthopedics, podiatry, nephrology, and urology. We use telehealth to expand services like psychiatry, behavioral health, endocrinology, and other services. For a rural tribal nation, this is transformational. On the public health side, our community trust has grown each year. We protected our people through COVID-19. In 2025, our public health department received national accreditation, only the 8th tribe to do that for their public health department. And finally, based on these experiences, I want to offer some recommendations for 638 modernization. Develop and publish uniform performance metrics. Tribes, IHS, and Congress need consistent data on approval timelines, staffing, and pending contract actions. Create a comprehensive 638 implementation manual. Just like the BIA, IH needs clear, standardized procedures so tribes are not navigating inconsistent guidance across areas. Strengthen area office capacity and accountability. This is a big one for the Winnebago tribe. GAO has repeatedly identified deficiencies. Addressing this is essential to getting IHS off the high risk. Reduction of the federal footprint does not alleviate the responsibility or accountability to self-governance tribes. And in fact, in my area, in the Great Plains area, the area director told my tribe that 90% of his time is spent on direct service tribes. And so capacity needs to be built, accountability needs to be built and maintained for self-governance tribes, and there needs to be a willingness to work with the tribe as they take on these roles and excel. Improve transparency and communication with tribes. Regularly structured engagement will reduce uncertainty and support better decision makings. Clarify and fully fund inherently federal functions. Restructure and distribution of program funds, new and existing resources, especially in behavioral health and public health. Those should flow through the ISDEA contracts and not through a grant program. A grant is not a fulfillment of the trust responsibility. And I just want to say that broadly, not just with IHS, all of HHS, a grant program is not a fulfillment of the trust responsibility when you have $1 and all the tribes have to go after it. It's just very sad. In conclusion, I just want to say that the Winnebago tribe took a struggling hospital and turned it into a model of excellence. We did this through self-determination and self-governance. Modernizing the 638 process is a central pathway to saving lives, restoring dignity for tribal nations. We thank you for the opportunity to testify and look forward to answering your questions and working closely with you to not only improve and strengthen 638 contracting, but possibly expand it.